On Wednesday the 6th of March, Stockport LInk held their final AGM. Elections were also held for the Healthwatch Stockport Board of Directors.
It's going to hopefully be a celebratory occasion that will showcase some of the work we've done over the last few years and welcome in a new set of Board of Directors.
We were lucky in Stockport because Healthwatch has been allowed to develop from LInk in a lot of places in the country, and in the majority of places in the northwest, links have just been scrapped. In Stockport we're fortunate. And I'm going to, it's been said before, but I'm going to thank Stockport Council and councillors for that, because they have seen...
So my name's Sarah Newsom, and it's happily fallen to my team to basically set up Healthwatch and manage the transition from links to Healthwatch. And at the very beginning of that process, about 2 years ago, really the role of the local authority was simply to establish a new organisation. And we've really been true to that original vision, because that was the original DH vision, to establish a new organisation, a new independent consumer organisation, and I really want to emphasise that, because that very much is where Stockport Council has been from the word go, going back about 2 years.
Certificates were handed out on the night to LInk members to thank them for the work they've carried out on behalf of the LInk. This was followed by voting for Healthwatch Stockport Board Directors, of which candidates gave a presentation. The board's overall purpose is to ensure Healthwatch Stockport's objectives are delivered in the best way possible, while ensuring that all legal requirements, duties and good practices are maintained.
These are the people who received the most votes in the Healthwatch first elections. David Atkinson, Sue Carroll, Alan Zutter, John Reach, David Moore and Anthony Stokes.
Okay, hi, I'm David Moore. I'm really pleased to have just been voted one of the new Healthwatch directors. I've been working with the LInk for a number of years now, and we're really excited about taking that work forward. Have a real new impetus. We want to get amongst the providers in Stockport now and really shake up the services, work with people like the clinical commissioning groups and the trusts, and provide some fantastic services in Stockport for the residents of Stockport.
This is Tony Stokes, just been voted a Director of Healthwatch, and my ambition is to actually improve health and social welfare in Stockport, make it the best it can possibly be.
Hello, I'm Sue Carroll, and I've just been elected a Director of Healthwatch Stockport. I'm absolutely passionate about improving health and social care for the residents of Stockport and for those people from outside who use the services, and I also want to make sure that we've got the right underpinnings to allow Healthwatch Stockport to flourish.
My name is Anand Datta, and with my knowledge of the pharmaceutical drugs, with other neurological diseases and many other kind of aspects, so I thought I can contribute and use that knowledge for the benefit of the community.
My name is David Atkinson. I've just been voted onto the board of Healthwatch Stockport Limited. I was previously a shadow director, been involved in setting the company up, and I'm very, very pleased to be able to continue this work to its fruition.